Welcome to today's explainer. Look, if you've been scrolling through social media anytime recently, you have absolutely seen them. Those miraculous, literally overnight smile transformations. They look amazing, right? But it does beg a pretty fascinating question. What's actually happening behind all those filters? Today, we're cutting straight through the noise to demystify some of the biggest trends in cosmetic dentistry, pulling directly from the clinical expertise over at Vinnova Dental. We're going to break down the science, the art, and honestly, the structural reality of what it actually takes to build a confident smile. So, let's just dive right in. This is probably the single most common, incredibly alluring question floating around the cosmetic dentistry world right now. My teeth are crooked, can I just skip the braces and go straight to veneers? And honestly, it's completely understandable why this idea is so ridiculously popular. Traditional braces take years. Even clear liners take a lot of time, discipline, and patience. Who wouldn't want to just fast forward to the end and get that flawless result immediately? It's a highly seductive idea, and it has absolutely caught fire online. And that brings us to the real meat of what we're exploring today, this concept of instant orthodontics. In a nutshell, this is that viral trend of walking into a clinic with a misaligned smile and walking out, maybe a couple of weeks later, with perfectly straight teeth. No metal wires, no clear aligners, zero waiting around. It sounds like the absolute dream scenario, doesn't it? But, whenever something sounds just a little too perfect, especially when we're talking about your actual biology and your long-term health, we really have to stop and ask, okay, what's the catch? Because there is a catch. It all comes down to balancing what we want cosmetically with our underlying structural health. So let's unpack exactly when veneers actually can work as this magic instant fix and when they absolutely 100% cannot. Let's start with the good news, because there definitely is some. Veneers are phenomenal. Really, they are, but specifically for minor misalignments. We're talking about maybe a slight gap between your two front teeth, or a situation where just a single tooth is angled a tiny bit backwards. For those highly specific cases, custom porcelain veneers are a brilliant, lightning-fast solution to correct minor cosmetic flaws. The clinical team actually describes the mechanics behind this as being almost like an optical illusion, and this is so crucial to understand. The tooth itself, the actual root that's physically anchored into your jawbone, hasn't moved an inch. It's staying exactly where it's always been. But the dentist takes a highly precise digital scan, completely redesigns the smile, and crafts a porcelain veneer that builds that specific tooth out. It literally tricks the eye. It sits perfectly flush with the rest of your dental arch, so for small gaps or really minor crowding, it's an incredibly fast cosmetic solution. But here is where we really need to pivot and look at the harsh biological reality of what happens when things aren't so minor. If we're just talking about a minor misalignment, the dentist only needs to do some microscopic enamel removal. They're just shaving away a tiny fraction of a millimeter so the veneer fits naturally and doesn't look overly bulky. But think about severe crowding for a second. What if a couple of your teeth are overlapping significantly or you're dealing with a really severe overbite? If a tooth is pushed way out of alignment, you can't just slap a veneer on it and call it a day. To actually pull that tooth back into alignment cosmetically, the dentist would have to shave away a massive amount of healthy tooth structure. You are literally grinding down your healthy, natural tooth to force a thick chunk of porcelain over the top of it. Which brings us to a really serious, absolutely foundational principle in modern clinical dentistry. Conservation first. A stunning smile has to be structurally healthy underneath. Grinding away vast amounts of perfectly healthy natural enamel just for the sake of a fast cosmetic fix? That fundamentally contradicts core clinical philosophies. If you don't respect the underlying structure of the mouth, your cosmetic fix is really nothing more than a band-aid. And honestly, it's a highly destructive one. We really need to sound the alarm on what actually happens when we prioritize speed over biology. If you force a veneer onto a severely overlapping tooth by aggressively grinding it down, you are setting yourself up for a whole cascade of nightmares. First off, it can compromise the nerve of the tooth. Second, it drastically weakens the tooth's overall structure. Third, you are shortening that tooth's lifespan, plain and simple. And finally, you are looking at serious, severe risks of complications within just 5 years. Really think about that for a second. You pay all this money for your absolute dream smile, and in 5 years, you could be dealing with nerve damage, failing teeth, and absolutely massive dental bills. That is the dark side of instant orthodontics when it's done on the wrong patient. Okay, let's relieve some of that tension, right? Because there is an incredible, biologically sound solution that gives you exactly what you want, minus all that destruction. It's called pre-restorative alignment. Basically, this is a hybrid approach. It uses clear, virtually invisible aligners to gently move your teeth into a safe, functional position first before anyone even touches a drill to place minimal prep veneers. This is how you get both things, the ultimate cosmetic dream smile and long-term structural integrity. You literally do not have to choose between having a beautiful smile and having healthy teeth. I actually love how the experts at Vinnova Dental frame this because it totally shifts how we typically think about clear aligners. They say, we're not necessarily trying to get the teeth to 100% cosmetic perfection with the aligners, we just need to get them into the right neighborhood. And honestly, that is so reassuring. If you need aligners before getting your veneers, it is not some grueling years-long ordeal. It's just a brief pit stop. The goal isn't absolute textbook orthodontic perfection. It's just about untangling the foundation enough so the teeth aren't severely overlapping or jutting out anymore. It really just boils down to a super simple two-step playbook. Step 1, clear aligners. You pop in these invisible trays for just a few short months to safely untangle your foundation. They do all the heavy structural lifting, shifting the teeth just enough so they don't require any aggressive shaving down later. Then, step 2, minimal prep veneers. Because the foundation is now safe and sound, the dentist only has to do some microscopic prep work to deliver that flawless shape, the perfect color, and absolute symmetry. The aligners do the heavy lifting, and the veneers come in at the end to give you that spectacular red carpet finish without trashing your enamel. So let's put these two methods head to head for a second, because this is where the rubber really meets the road for you. Instant orthodontics? Fast. Absolutely. But if you have moderate or severe crowding, you're risking severe complications in just 5 years. On the flip side, pre-restorative alignment requires a little bit of patience up front. Maybe a few months of wearing clear aligners, but it guarantees a smile that's going to last you a lifetime. When you actually weigh the long-term value of your dental health, the choice is a no-brainer. A few months of patience is a microscopic price to pay to protect the nerves and the lifespan of your natural teeth. So, how do you actually know which approach you need? According to the team at Vinnova Dental, it all starts with the data. Their whole process kicks off with advanced digital scanning to deeply evaluate your specific bite geometry. Because, look, every single mouth is completely different. They use this hard data to map out exactly which cosmetic camp your smile falls into. This ensures that any treatment plan is based on actual hard geometric facts, not just some dentist making a guess. It's all about exploring your options driven purely by the unique structural architecture of your teeth with zero pressure. Which leaves us with one final incredibly powerful thought to weigh. The next time you look in the mirror and think about investing in your appearance, ask yourself, will your smile last a lifetime or just 5 years? True lasting beauty is always built on a foundation of structural health. Do not let the allure of an overnight fix end up costing you your natural teeth down the line. Thank you so much for joining me on this explainer. Take care of your biology and keep smiling.